Welcome back to the National Defense. It's Randy Miller, and I got to introduce you to a guy that is is doing some phenomenal work. Colonel Gary Morsch is on the National Defense. Dr. Morsch, how are you?
I'm doing great. It's a beautiful day here in Gallup, New Mexico.
Well, and let's talk about that a little bit, because we need to say that also Dr. Morsch is the founder and president of the COVID Care Force at covidcareforce.org, and also, of course, founder of Heart to Heart International, that we know a lot about in Kansas City because it's been around. How long has Heart to Heart been around Kansas City, Dr. Morsch?
Yes, 28 years.
Wow.
It was founded in 1992, so 28 years old.
So, I mean, you're not a stranger at all to rushing into places that people are running out of, right?
That's exactly right. I've been doing that all my life, and maybe there was a genetic defect or something. I've been doing that in disasters, but I was doing it in the military for 21 years. So, I can remember in basic training even when the captain stood up in front of us and said, "We need some volunteers that would want to take a test to see if they could be eligible to learn language, has some kind of language proficiency." And I volunteered to take every test, to do everything, because I found out when you do that, it opens up your world to opportunities you would never have. And indeed, I studied Russian. While I was in basic training, I started taking Russian classes, believe it or not.
Oh, wow. Well, I mean, it has prepared you for what you're doing now. Absolutely. And let's talk about that a little bit, because this COVID Care Force is something that you formed out of this huge need for doctors and nurses in critical situations. You guys went to New York first, the hot spot in the world at the time of the COVID-19. How was that experience?
Well, we again, I saw what was happening in China, and Heart to Heart has worked in China and still does. And I travel to China a lot, and just what was happening in that part of the world. I was actually in Southeast Asia when COVID was just being talked about and announced and starting to creep in to Southeast Asia, spill over the borders. And so I thought, this is going to be a worldwide disaster, really. They were calling it a pandemic. I thought, oh, this is going to be worse than a pandemic.
Yeah.
This is going to be the worst disaster of my life and perhaps in modern history. Who knows? We'll know as it looks back. So I decided right then, I've got to do something. And I've got to respond more and faster and bigger than I ever have. This is a time for all hands on deck. And you're right, the epicenter, it was all about New York City. So I immediately registered when Governor Cuomo was asking for volunteers to sign up and register. I did. I went to New York on April the 8th with a team and of doctors and nurses. April 8th was the peak of COVID in New York City. Now, the cases started going down, but the hospitals continued to get fuller and fuller because there's kind of a tail after it peaks. These people that get tested, it takes 1, 2, 3 weeks before they're going to get sick if they're going to get critically ill. And so actually our numbers in the hospitals we were just getting slammed. So we were there at the right time. And then we saw it starting to slow, and the hospitals started to get a little bit less crowded. More volunteers were coming in. But I have volunteers still going to New York. This weekend, I'll have more doctors going to New York. We haven't given up. And they're still calling me. I get a call a week, either from the governor's office or the mayor's office, saying, "Can you send us more teams?"
Wow.
And people say, "Well, why aren't they?" Well, it's because the workforce, the healthcare professional workforce, is exhausted and beat up and depressed and tired, and they need to have a break. They've been working for 2 months or more, and guess what? Everyone believes a resurgence is coming.
Right.
So I think they're wise. Let's get volunteers out here to New York City and give some of our staff a break, and then get them back to strong and healthy, and be ready to go if a resurgence happens. So,
Well, and I was just going to say, I would think the doctors and nurses in New York were as happy or happier to see you guys than the patients. We're talking to Dr. Gary Morsch at the COVID Care Force here in the National Defense. So the other part of that, now I understand your passion and I understand that you're ready to go. How do you talk other doctors and nurses into going? I mean, that's got to be a trick in itself.
Yeah, well, I guess you in my case, honestly, I try to inspire people to share a vision that not everybody's going to respond to, of course.
Right.
But I know there's enough people. There's a segment of any profession, of any group. You take whether it's soldiers, whether it's businessmen in Rotary clubs that I speak to, whether it's students in a university, or whether it's healthcare professionals. There's a certain percentage of people that will grab a vision and say, this is what I need to do, even at great cost, even at great sacrifice, even if I have to put my life on the line. And that's what
you are.
Soldiers do. And that's what we're doing.
Yeah. I mean,
and people respond. Now, maybe you don't have enough, but a few is better than nothing. So whatever I can get, whoever I can inspire. But what happens in this day of social media then, of course, people can share things and you can get the word out faster. In the old days, you had to do direct mail or whatever. And now there's ways to get it out. And I have quite a network among lots of medical organizations, nursing organizations. So we have 250 people that have volunteered to date.
Wow. That's
Nurses
incredible.
And doctors.
And then after your trip to New York, you came back to Kansas, self-quarantined. And then, I mean, honestly, Dr. Morsch, a lot of people at that point would have said, job well done. We can't believe you did it. Thank you so much. But you're out looking for other places. And then all of this news about Navajo Nation and the lack of professionals, the lack of equipment, that kind of a thing. And you decided that's where we're going to go next, right?
Exactly. Well, I've got friends here in the Navajo Nation. And while I was in New York, I got a call from one of the members of the involved in the tribal council of the Navajo Nation, who told me that COVID was just breaking out in the Navajo Nation, and asked if there was any way that Heart to Heart could send in hand sanitizers and masks and other things. And so while I was even in New York, Heart to Heart got organized, and they have sent 2 or 3 shipments out here to the Navajo Nation even before I got here. That is one of the great strengths of Heart to Heart. They can mobilize PPE and product and water and hand sanitizers, and they've been doing a great job sending it all over the world during this pandemic. But once I heard that COVID had broken out, I knew what was going to happen. I had a good idea. The Navajo people live, even though they live very isolated, far from each other, but they live in large family groups. So one house or one trailer will have multi-generations in it. It might have 10 people living very close together in crowded conditions.
Right.
In addition, many Navajos don't have running water. How are you going to wash your hands if you have to walk a mile or drive your pickup truck 5 miles to get, fill up your container, your barrels of water? So that's a problem. Some Navajos don't have electricity. The other thing is they're very social. They have certain beliefs about medicine and health and all that. And so it's just a whole different. So they had all the ingredients for COVID to really be devastating. In addition, the Navajo people as a whole have more diabetes, have more hypertension.
Oh, sure.
Have more cardiac disease. These are things that make you higher risk. So all those factors together said to me, COVID is going to be bad. This is going to be the next hotspot. Even before it came on the news, I just had this intuition. This is going to be bad. And it's going to be bad for every Indian reservation eventually. Most likely, hopefully not.
Sure.
And so I made contacts. One of my staff made contacts with the Indian Health Service in Washington, We were put in touch with leaders of the Indian Health Service and directed, they actually introduced us by phone and email to the leaders all the way down to the Navajo Nation. We met with them by Zoom and told them what we thought we could do in sending volunteers. And they said, "You're the first group to do this."
Wow.
Doctors Without Borders made the news yesterday, national news, because they sent in a team yesterday or the day before, and of advisors, 9 people. Guess what? I've had teams on the ground in 4 different places.
Yeah, you guys.
2 weeks now.
I was going to say, you guys have been there for a while.
Yeah.
And what, and when all of that came about with the Navajo Nation, they were almost begging. I mean, they were reaching out and saying, "We need the help," and nobody was helping. And then you send these teams in. How was that reception?
Oh, I have never met with more cooperative, kind, helpful people than the Navajo people at every level. And remember, the Navajo Nation, even though we say it's a nation, and it has a president of the nation, President Nez. But it's like all Indian reservations. You have the federal government, Bureau of Indian Affairs involved. Then you have the Indian Health Service involved, and they have a component. Well, then the tribe itself, this is their sovereign land. They have their own healthcare facilities that they fund. And then there's NGOs and groups outside that might have some kind of a work that they carry on. And then, so it's so complicated. But I felt like what I wanted to do was get here, boots on the ground, as soon as I could, and build relationships face to face with all of these entities. And so I've been able to do that. And so I have direct access and have met with and built trusted relationships with every entity. And we're working with every group. We're not just here. The Indian Health Service opened the door for us. They have 5 hospitals. We're working in 2 of them, getting ready to go to a 3rd one. So we'll be helping staff all of the Indian Health Service hospitals. But then the tribe has several hospitals that it runs as well. So we've already met with them, and they said, yes, we need your help for our hospitals. So we're sending doctors and nurses to their hospitals. And then there's also some private hospitals, not for profit. There's a large one here in Gallup. And we have a team of nurses arriving today because they had about 30 nurses out of their, say, 60 nurses get COVID and get sick. And so they're way, way short of nurses. And so no one had offered, they didn't have a source for nurses. And so I met with them last week and on a Saturday. This was last Saturday. Here it is only what?
Yeah.
Wednesday.
Yeah.
And on Saturday, I went and met with all the heads of their departments and their chief nursing officer and their chief medical officer and said, what is it you need? And they just said nurses. Our nurses are about ready to quit. They're just to the point of exhaustion. And we're understaffed. And I said, well, we can get you nurses. And they said, how soon? Well, they were expecting us, to say something. Well, probably in a month.
Right.
I said, how about next week? And literally, the director of nursing, she just started crying. And she grabbed her chest. She goes, next week? And she looked at the other people around and she goes, did you hear that? Are you serious? I said, well, I can't guarantee it, but I'm pretty certain we can have nurses here. And I said, but we've got to work out the details. Well, we got them worked out.
Wow.
And 6 nurses are arriving today at Albuquerque by 1 p.m. They'll all be here on their way over here in rented cars. And we've got their hotel. And they'll go to work at 8 o'clock tomorrow morning. I'll be there. They'll be oriented. And we have nurses that will work in their ICU, work in their ER, and work on the floor. And I'm going to keep sending them nurses. The Indian Health Service, between all the hospitals and all the groups, they are needing a couple hundred nurses right now.
Wow.
Right now.
Okay, well, on that note, if we have some nurses listening, if we have some medics listening, if we have like retired medics or whatever, and they want to volunteer with the COVID Care Force, what do they do?
Get in the car and drive out here. No, I'm just joking.
Right. Be here tomorrow.
They go to our website. It's all right there. You can hit is a button. It doesn't say volunteer. It says serve. But you go to www.covidcareforce.org. covidcareforce.org, and that'll give you that you go right to a page to volunteer. It's a simple one-page application that allows us to start building a file, getting your credentials. And yes, we can take medics and EMTs. We have an EMT coming in today that he's going to be working as a nursing assistant because, we can use every kind.
Right.
And the other thing they're begging for is respiratory therapists.
Therapists. Sure. Yeah.
So people on the ventilators need respiratory therapists.
Yeah, we're talking to Dr. Gary Morsch here in the National Defense. And Dr. Morsch, what is the situation right now with the spread of COVID in Navajo Nation?
Well, in most of the country, it has flattened. It's flattening. However, with the return to work and all that, there is fear that it may start going up again. And so there's different ideas. But I can tell you one thing. The Navajo Nation has the highest infection rate in the United States.
Wow.
The highest percentage of the population, a higher percentage of their population are getting sick with COVID than anywhere else in the United States. Number two fact, the peak, they have not hit their peak because there's several areas of the nation, the res, as they call it, that because they live so isolated, it hasn't creeped into those areas, but it will in time. And so the projections for the peak for the Navajo Nation are anywhere from the end of May to June. And the latest one I just received from the chief of medicine at the Gallup Indian Medical Center here in Gallup, where we're working too, is that the peak will be in July. Well, we don't know.
Right.
You only know the peak when you look behind you. And all of these are just best guesses. The scientists, I think we have to listen to them and prepare for the worst and then pray and hope for the best.
Yeah.
But you got to be prepared. In New York City, it hit them so fast, they were not prepared. They threw everything they had at it. The greatest city in the world, the most medically advanced city probably.
Right.
And it had just about killed them. But they were able, by volunteers and other things, and a great governor who led the fight, to do what was needed. And so the Navajo Nation doesn't have those kind of resources.
Right. I mean, you've gone from the most medically advanced to possibly the least medically advanced.
You're right. So we want to be here early before the peak and help fill in these spots. Before COVID hit, they only were staffing their nursing positions at 56%. They were already behind. They had 44% of their nursing positions were unfilled.
Oh, wow.
That's a chronic problem with the Indian Health Service. And there's lots of reasons for it. But the fact is they were already short. COVID hits. So what do you do now? And now COVID is going and nurses are starting to get sick. They're getting tired. That's why they need 200 nurses today.
Yeah.
My goal is to get 1,000 nurses out here over the next several months to really support them. And, you and I have talked about the Navajo Code Talkers.
Yeah.
They came to our rescue, in World War II. It's time for us to come to their rescue.
I mean, amen. We've been fortunate enough and honored to interview a couple of Navajo Code Talkers in the past on this show. And number one, a lot of people don't realize their contributions, that they absolutely did help us to win the war. But number two, they haven't been honored nearly as much as they should have. So kind of, your situation and your idea of kind of coming full circle and repaying them, boy, what a beautiful thing that is.
Well, let me tell you, I had always heard of the Navajo Code Talkers, but I went to the tribal headquarters yesterday for some meetings the last couple of days. And yesterday I decided to take some time and go to the monument and see the tribal chambers where the tribal council meets. And I decided that I stood in front of this beautiful monument of a Navajo Code Talker kneeling with his radio in his hand. And it was just moving. And then I read the plaque. And I had always heard about the code talkers, but, I just didn't know it that much. But you're right. It started with 29 Navajo men volunteered to join the Marines to fight, just to defend our country. And during the war, the Japanese were breaking every code we had.
Right.
They're so smart. And I don't know who came up with the idea. It might have been one of the Navajos and said, "Hey,
it was.
Was it really?
Yeah, it was one of the Navajos that came up with the idea
Wow.
of their own special language, which could not be broken. And the great thing, the other obstacle they had, Dr. Morsch, was the fact that the Marines didn't want them there. So now you've got a group of guys who are rescuing the country with this code.
Exactly.
It's just incredible.
Well,
it's incredible.
The 29 that went originally became, by the end of the war, 400. So whatever, do the math, 379 more Navajos or whatever it is, 371 more code talkers, Navajos joined.
Yeah.
And that became the code that won the war for us. And in fact, on that plaque, it quoted some famous general. What's the most iconic image we have of the Pacific War? It's the flag raising at Iwo Jima.
Iwo Jima, yeah.
Yeah, that's probably the most iconic image. So that was like, that's when we won the war. That was like, we did it. And then it was maybe downhill ever since. I don't know if it was or not, but that's in my mind. That was the moment of victory. And I read on the plaque, a general said, "We would have never won the Battle of Iwo Jima had it not been for the Navajo code talkers."
Absolutely.
So next to that flag ought to be a Navajo code talker kneeling.
Yeah,
on
you're right.
Radio.
Yeah,
that ought to be the image.
You're
of
right.
Iwo Jima.
You're right.
And yet, you're like you say, the Navajos haven't gotten the credit, that they deserve. So that's one reason I'm out here. These are our Native Americans. These are our first Americans. These are all of our, we may have come from Europe and this and that, but these are the people's land that
absolutely
allowed us in. Now, we didn't do it all right, but they've shared the land with us. And America is what it is today because they have this land and the natural resources. And we owe it to, we should go to New York City or Detroit or New Orleans and help with COVID. But by golly, if we can't come to the Navajo Nation,
right,
who have done so much for us and who are really our ancestors, and for many of your listeners, literally their ancestors,
right,
for me as well, it's part of my heritage. Why can't I come and say, thank you for what you've done. Thank you for sharing the land. Thank you for sharing the resources that we have taken and made ourselves rich. And thank you for winning World War II for us.
Yeah, and thank you.
Now it's our time. Yeah.
And thank you for discovering all of the natural healing remedies that everybody is now using. That's the other part of that. But well, Dr. Morsch, I can't thank you for number one for taking the time, but and I thank you for your heart. I can't pretend to understand how you do this. I mean, it does take a special mentality to put yourself at risk to save other people, but you've been doing it your entire life. And once again, I want to mention, if you go to covidcareforce.org, that's covidcareforce.org, you can find out different ways to support them, to serve. And man, God bless you for what you're doing, and thank you for everything.
Thank you, Randy. And I'm just so proud to be a veteran, so proud to have served all over the world with my brothers and sisters in uniform. And I invite all of them and their families and whoever's listening, get the word out. This is our time again to stand up and raise our hand and say, I'll go. And we can put you to work. I guarantee it. So,
you're doing it again, Colonel. Out. Thank you so much.
That's right.
Hey,
thanks, Randy.
Stay safe. Thank you so much.
All right. Thank you.
We'll be right back here on the National Defense.
This is the National Defense.